Hi, I am Dr. Raghav Malik, consultant, Cataract, Refractive and Cornea Surgical Sciences at Center for Sight. So I am very often asked by my patients that, Doctor, what if during the procedure I can't control my eye and my eye moves? So it's a very valid question. Why? Because we are talking about lasers that are firing at the frequency of 500 or 1000 megahertz. That means that they are firing at about 1000 times per second. Just imagine the speed of those lasers. Our eyes, of course, are not that fast. So what will happen if the eyes actually move during the laser? So there are two components to it. One is the blinking part and the second is the movement of the eyeball itself. So for the blinking part, most surgeons prefer using a speculum or a small clip to keep your eyes open. So with that, you will not be able to blink. So rest assured, you will be very comfortable. We put some numbing drops, your eyes become numb. There is no pain, there is no sensation. You will not feel that something is touching your eye. You will only feel that there is drops of cold water falling on your eye, which is very comfortable. So first of all, after we put the clip, the eyes do not blink, number one. Secondly, about the movement. Yes, so what happens is there are two types of procedures in the refractive surgery game. So one is that we have to have something known as the LASIK, and the other is a CLEX that includes the SMILE and the SILK procedure. So what happens is that in the LASIK procedure, the LASIK is a two-step procedure. In the first step, we actually attach the eye to a femtosecond laser that is going to create a flap on the cornea, and the second step involves a second type of laser known as Excimer laser that actually burns some tissue and reshapes the cornea to remove the problem. So what happens is that during the first step, when the femtosecond laser is actually firing, it does not really matter because your eye is stuck to the laser machine through something known as a patient interface. So the chance of the eye moving during that procedure is very, very less. But during the second step, once the Excimer laser is firing, what happens is there can be micro movements of the eyes. So therefore, in order to prevent any damage because of that, what happens is the modern laser machines have something known as an eye tracker. So what they do is they track your eye and they take an image of your eye before the surgery even begins, so that even if there are any micro movements, the laser heads actually follow the eye. So that is why it is very important to have an advanced laser that actually has a modern eye tracker. So one of the latest laser machines that we have is the Schwind Amaris 1050RS. The advantage of the machine is that it has 7-dimensional tracking. That even if your eye moves in 7 dimensions, you only know of only 4 or 5 dimensions, that is right, left, up, down. But there are multiple more dimensions of movement of the eye. To the right, to the left, down, up. There is a movement which is in the vertical axis, up and down, and there is two directions of rotation of the eye known as cyclotorsion. So what happens is, once you are sitting down, your eyes are in this position, but once you lie down, the eyes actually move. This is known as a cyclotorsion. So all these movements are actually compensated for by the laser. So the eye is grabbed, the image of the eye is grabbed by the machine, and once the eye moves, the laser immediately moves with it. And because the laser is so fast, it can move much faster than the eye. So be rest assured that even if your eye moves during the surgery, there will be no damage. There will be no chance of your eye not being corrected properly if you go for a modern Excimer laser or a modern type of LASIK like a customized LASIK. So this is about LASIK. But if I go on to the CLEX procedures, the chance of your eye moving and causing any damage or any negative effects is even much lesser. Why? Because it involves only one laser, a femtosecond laser. The femtosecond laser attaches to your eye through a cone, and even if your eyes do move, there is no damage because it's a laser, right? So a laser procedure will always be much less damaging to the eye compared to a blade procedure. So rest assured, even if your eyes do move during the procedure, they will be taken care of by the laser or your surgeon.
Follow Planet LASIK and post your queries to get answers from the experts.